కరోనా వ్యాక్సిన్ డ్రైవ్ ను వీలైనంతగా పెంచడం ద్వారానే ఇండియాలో సంక్షోభాన్ని అంతం చేయగలమన్నారు వైట్ హౌస్ చీఫ్ మెడికల్ అడ్వైజర్ ఆంటోనీ ఫౌసి. కోవిషీల్డ్ 2 డోసుల మధ్య గ్యాప్ పెంచుతూ కేంద్ర ప్రభుత్వం తీసుకున్న నిర్ణయాన్ని ఫౌసి సమర్థించారు. 2 డోసుల మధ్య వ్యవధి పెంచడం సరైన చర్య అన్నారు. గ్యాప్ పెంచడం వల్ల వ్యాక్సిన్ పనితీరుపై ఎలాంటి ప్రభావం చూపదన్నారు. భారత్లో కరోనా వ్యాప్తి భారీగా ఉందని ఇప్పుడే ప్రయాణాలు ప్రారంభించడం కష్టమన్నారు.
I would not refer to it as a cover-up. When you don't have enough vaccines, what you've got to do is try to get as many people vaccinated as you possibly can. And for that reason, when you have a shortage of vaccine, extending the duration between the first and the second dose in order to get more people to at least get a first dose is a reasonable approach. The fact that you delay it that long, it is very unlikely that it would have a negative effect on the efficacy of the vaccine. So in many respects, when you are in a very difficult situation, the way you are in India, you have to try and figure out ways to get as many vaccines into people as quickly as you can. So that, I believe, is a reasonable approach to do. I wouldn't call that a cover-up at all. You know, I don't have much information on the COVAX, but what I do know is that the reports that I've heard about the Sputnik is that it seems to be quite efficacious, you know, at a high level, close to 90% or so. But I don't have enough information on the COVAX to really say anything that would be helpful. Well, obviously that decision is going to have to be made by the Indian authorities. But I do know that particularly the thing I had suggested in another conversation with Indian journalists is that you can use the military sometimes to get things done quickly that you otherwise in the private sector would not be able to. For example, I know that there's a shortage of hospital beds right now, that people who need to be in a hospital are not getting into a hospital because of the shortage of the beds. You can get the military to put up field hospitals the same way they would during time of war that could serve as a substitute for the classic hospital. In the United States, we have used our military to get the distribution of the vaccines to various locations throughout the country. In fact, the person that was put in charge of that is a 4-star general, General Gus Perna, who is responsible for efficiently and effectively getting doses to multiple different locations throughout the country. Well, vaccine passports, I will not be mandated ever centrally from the United States federal government. But certainly we already know that there are going to be different organizations that are going to be requiring validation and verification of vaccination. One of them may be airlines. So I don't think the government is going to do it. But several of the airlines may say you're not going to be able to fly on our flight unless you have a verification that you've been vaccinated. In essence, a vaccine passport. But again, to repeat that, at least in the United States, that is not going to be mandated from a federal standpoint. And with regard to travel, it really is going to depend on the level of infection. Right now, India has a very, very, very level of infection. And that would mean that it would be very, very difficult to resume travel there right now.